Hello Wayne County Community College students. This video is going to be about endocrinology or endocrine and reproduction. Let's start with reproduction now. Let's actually start with the male reproduction, okay? So the male reproduction is the proper functioning of the reproductive system, and it's enormously complex control mechanism that ensures the survival not only of the individual but of the species. Actually, that is just a broad definition of reproduction, period, not specifically male reproduction. So that's just reproduction, period. But male reproduction, that's a system that consists of organs whose functions are to produce, transfer, and eventually introduce mature sperm into the female reproductive tract. And this, of course, is where fertilization can occur. The testes secrete androgens, known as testosterone, or that's considered the male sex hormone. Organs of the reproductive system classified as essential organs for the production of gametes. Remember, gametes are the sex cells. That is the genital ducts, glands, and supporting structures of the accessory organs that play some type of supportive role in the reproductive process. Gonads are the essential organs of reproduction that produce the sex cells or the gametes. Gametes are going to be the sperm in this case. In the female, they will be the eggs or the ova, but that's what gametes are. The gonads of the male are the testes, and we'll compare that later to the female. So just so you know, for the female, they're the ovaries. So the gametes is the sperm in the male, and the gonads hold the sperm, and the gonads are the testes. So the genital ducts allow the sperm to travel outside the body. This is during ejaculation. So the sperm is really traveling through a duct system, a tube, so to speak. So there are 3 paired ducts and a single urethra. So 3 pairs and a single urethra. Let's start with one of the first ducts, the epididymis. The epididymis consists of a single, tightly coiled, enclosed, comma-shaped structure that's enclosed in a fibrous casing. It's very long. It's about 20 feet long. And posteriorly, it rests on the testes. The main function of the epididymis is that it's one of the ducts that sperm passes through from the testes to out of the body. It's one of the ducts that takes sperm from the testes to go out of the body. It contributes to the maturation of sperm, so sperm should be mature, and the sperm stays in the epididymis about 1 to 3 weeks. It does secrete a small portion of the seminal fluid, known as semen. So let's look at it. So here is a testes here, and then the epididymis kind of sits on it, kind of like this. And it's like a comma-shaped thing with a lot of coils and it's coiled tightly, and then it uncoils and goes up through that tube. And this tube here is known as the vas deferens or the ductus deferens. So leaving the epididymis, this tightly coiled, comma-shaped, fibrous encased structure will uncoil a bit and go up through this next duct known as the vas deferens. So let's look at the vas deferens. Also known as the ductus deferens. So this duct is really an extension of the tail portion of the epididymis. Okay? You can see it here. Here's the epididymis. And then this extension here going on up is the vas deferens or the ductus deferens. It is indeed an extension of the epididymis. It's a thicker muscular wall. It says thicker muscular walls, easily palpated in the scrotal sac, so you can feel it quite easily in the scrotal sac, as a smooth, movable cord. It ascends from the scrotum and passes through the inguinal canal into the abdominal cavity. It has 3 muscular layers. The vas deferens has 3 muscular layers. When the sperm is coming on up through here, it does have 3 muscular layers that allow to help assist. So it has an inner and outer longitudinal layer and a thick intermediate circular layer. It assists in the propelling sperm through the duct. So the sperm don't have to really do 100% of they do all the swimming, but they don't have to do 100% of all the movement. In other words, the sperm gets assisted by muscular contractile activity that helps propel the sperm along. Because it's a long journey for the sperm. Function of the vas deferens or the ductus deferens is one of the male genital ducts connecting the epididymis with the ejaculatory duct. Sperm remains in the vas deferens depending on the frequency of ejaculation. So if the sperm will stay in the vas deferens as long as the male does not ejaculate. Maybe not that exact sperm, of course not. But if he ejaculates every day, then it's different sperm in that duct. If he doesn't ejaculate for days and days, then still new sperm is going to be made. Storage time may be greater than 1 month with no loss of fertility. In other words, the same sperm can stay in the vas deferens for a little longer than a month, and the sperm will still be viable. It will not lose fertility. Ejaculatory ducts. That's the next paired duct. So all of these is 2 of these, 2 of these, 2 of these. So remember, they're paired ejaculatory ducts. Okay. These are little short tubes that pass through the prostate gland to terminate or end in the urethra. They're formed by the union of the vas deferens and the ducts with the seminal vesicles. All right, so we have these three paired ducts. It's 2 epididymis or epididymi. The epididymis is interesting in that it has, let's see. It's divided into a head, a body, and a tail. So you have, let me draw it a different way, just so I can kind of draw it. I'm going to just draw it like this. Just know that it kind of sits. All right, I'm just going to draw it like that. So it's divided into a head. That's superior, right? So I'm just going to make this like the head part. It's connected to the testes by the efferent ductals. Then it has a body, which is the central part. And then it has a tail. And of course, this is the tail. All those little squiggly ducts. And then once it gets into the tail, it unfolds up, and then it goes straight on up, like that. So this is the epididymis, the head, the body, the tail, and now the tail becomes the vas deferens. right? And of course, you know that that's one of the ducts that the sperm travels through to get out of the testes to eventually get out of the body. So let's look at this word emission. Emission. So I need you to know that emission is different than ejaculation. So emission is the discharge of semen. Discharge of semen into the prostatic urethra. To the prostatic. So here the semen is gone into, the semen has gone into where the urethra is coming through the central part of the prostate gland. Ejaculation this is a forceful expulsion of semen from the urethra. So forceful expulsion of semen from the urethra that's caused by a contraction of the urethra and the muscles in the pelvis and at the base of the penis. So this is a forceful ejaculation of semen from the urethra. And how does that happen? Well, you have some very forceful contractions of the urethra and the muscles in the pelvis and at the base of the penis. The urethra is an interesting tube in the male. The urethra in the male serves a dual system, serves two systems. It serves the reproductive system when the urethra is used to ejaculate semen, and it is used in the urinary system when the urethra is used to void urine. So urine is prevented from mixing with semen during ejaculation by a reflex closure of a sphincter, of the sphincter muscles that guard the bladder's opening. So if we were to just try to see how that, whoops. So here we have the urinary bladder, right? The bladder sits on top of what? The prostate gland, correct? And then we'll just put no, that's a little different. Let's just draw a different kind. All right, like that. So we have, here's the urinary bladder, so we'll call this the bladder. Here's the prostate. And here's the penis. So what's going to come directly from the bladder straight through the prostate to the end of the penis, here, to the meatus of the penis, that would be the urethra. So the urethra is going to be used to, of course, empty the bladder from urine, but also, I'm just going to try to draw some seminal vesicles here, and then have the ejaculatory duct, as we talked about here. The ejaculatory ducts come in to the prostatic urethra, in other words, the urethra that's in the prostate, and then sperm can come in through that way. So urine will come from the bladder, and then semen or sperm will come from the seminal vesicles through the ejaculatory ducts that enter into the urethra this way, okay? Accessory glands produce secretions that nourish, transport, and assist in sperm maturation. So we got these two paired glands, and the two pair glands are the seminal vesicles, which I've introduced here. These are seminal vesicles. Seminal vesicles, okay? One here and one here. We have a bulbourethral gland, also known as the Cowper's gland, and then we have a single prostate gland right here, okay? The seminal vesicles are these convoluted pouches, kind of small, about 5 to 7 centimeters in length, and they lie along the lower part of the posterior surface of the bladder, directly in front of the rectum. The function of the seminal vesicles are to secrete an alkaline, viscous liquid that constitutes about 60% of the semen volume. So we have the seminal vesicles. That secrete about 60% of the semen's volume. And this is, it also releases an alkaline material. This alkalinity helps neutralize the acid pH environment of the urethra, because remember, urine is coming through this urethra as well. So it will be a bit acidic just because urine is a bit acidic. And so you want this neutral, this alkaline material coming from the seminal vesicles to help neutralize the acidity of the urethra. And of course the vagina has a more acidic, environment as well. And so this seminal fluid will help neutralize the acidic environment of the vagina as well. So it will neutralize the acidity of the urethra coming from the male's urethra and the vagina in the female. Fructose is also utilized here at this point. It serves as a source of energy used for sperm motility after ejaculation. So the seminal vesicles secrete most of the volume of this fluid for this sperm to swim in. It secretes this alkaline substance to fight the acidic environments of the male's urethra and the female's vagina, and it secretes nutrients like fructose to help energize the sperm on their journey. Bulbourethral glands, also known as Cowper's glands, just going to depend on the author of which text you're reading. They resemble little peas in size and shape, with a duct about 1 inch, and it connects them to the urethra in the penis. So I'm just going to draw a little bulb here because it's called bulbourethra, and I'm going to make it kind of look like a little bulb. It also is small. It also adds a little more alkaline substance to the seminal fluid, but it also adds a mucus to help lubricate the urethra and help protect the sperm from friction during friction damage during ejaculation. Because you have to remember, this sperm is going out of the body, out of the penis like a locomotive. And if it hits the side of the duct or the side walls, it's going to crash. So you want to have a lot of fluid for the sperm to swim in. You need the mucus lining there to help, of course, with to reduce friction and to have a lot of lubrication. So those things are important. And it contributes about, the bulbourethra contributes about 5% of semen. The testes also contributes about 5%. So let's put the bulbourethra here. And see, it has the word urethra, so you'll know that it is indeed in the urethra. And this is about 5%. And let you know that the testes also produce about 5%. About 5% of semen. All right. Now the last one is the prostate gland. Prostate gland. So here we have the prostate gland here, sitting just below the urinary bladder, right here. It's just below the bladder and it's walnut shaped. The urethra passes through a small hole right in the center of the prostate. The prostate gland's function is it secretes a watery, milky looking, but slightly acidic fluid. And this contributes to approximately 30% of the seminal fluid. Citrate is found in the prostatic fluid, and this serves as a nutrient for sperm. Also, it has hyaluronidase, that's an enzyme to break down connective tissue and disperse the cells of the corona radiata that surround the ovum. So the prostate has enzymes in it that will help the sperm, assist the sperm to break down the protective wall around the egg once it tries to reach it to fertilize the egg, right? So that's pretty interesting about the prostate gland. And we said that is about, that leaves about 30% of seminal fluid. So we have 60, 30, that's 90, 95, 100%. This is how we get seminal fluid or semen, and that's the stuff that sperm swims in, right? All right. Testes, we know, are small ovoid organs. They're located in the scrotum. So you have the scrotum, and the testes sit in the scrotum, right? And they hang outside of the male's body. The scrotum is about, the testes are about 4 to 5 centimeters in length. They weigh about 10 to 15 grams. And you have 2 kinds of glands. We learned this before. Another organ that had 2 kinds of glands, exocrine and endocrine. Remember we learned that with the pancreas? Well, here we also have this with the testes. It's exocrine in that it has ducts. You know that because sperm goes through the ducts from the testes. But it's also an endocrine organ in that it produces a hormone known as testosterone. Good. And that goes out through the blood, doesn't use ducts. So you have the duct system that is exocrine, which the sperm goes through, and then you have the endocrine part of the testes that does not use ducts. It uses just blood, and the hormone testosterone goes through. So remember that. Spermatogenesis is the production of spermatozoa, which is sperm. The male gametes, or the reproductive cells, of course, are sperm. The seminiferous tubules produce the sperm, and most of the testes is made up of seminiferous tubules. A lot of little tubes, and they sit in the testes, and as the sperm is produced, it matures there and gets ready to be ejaculated out. Before puberty in boys, that's around age 12 to 14 for puberty, the tubule lacks a lumen and are not functional. So in here, it's a lot of, I'll just draw these lobules here, but it's a lot of tubes, seminiferous tubules in these testes. It ends up going into the epididymis as the sperm matures. But the point is, in these tubes, I'll just pretend that this is one of the tubes. The tube is blocked. It's not open. The lumen is blocked. Like that. So no sperm can go through that. So prior to puberty, no sperm can get through there. So sometimes you'll read in tabloids, and I've read this before, 10-year-old impregnates babysitter. Well, first of all, that is a crime. But secondly of all, it's going to be freaking impossible because his tubes are solid. There's no lumen in it for sperm to get out. So sometimes I just want you to stop for a minute and think about what, all these tabloids and then all the stuff we hear on television and on social media, because this tube is not going to be functional, okay? During puberty, however, increased Leydig cells, also known as the interstitial cells, will start to secrete testosterone, and a lumen develops in each seminiferous tubule. Then sperm production can begin. So after you hit puberty, now you're older than 14, and now a lumen will develop, the opening will come through, and then now sperm can go through, okay? It'll open up in the seminiferous tubules here. That's what this represents, a larger version of these. And then sperm production can begin. This takes about 74 days for a sperm cell to be produced. So it's a little bit over 2 months. About 50 of those days are spent in the seminiferous tubules. So a lot of time is spent in these seminiferous tubules. Most of the testes is made up of seminiferous tubules, by the way. 50 of those 74 days, the sperm stays in the seminiferous tubule. This is because sperm has to mature. Another maturation ripening process is known as capacitation. And I put that word somewhere. Let's see. Capacitation. Capacitation is very important because it must occur in the sperm in order to fertilize an egg. So this is a maturing type of thing that must go on with the sperm before it can actually fertilize an egg. First, when introduced to the vagina, the enzyme, hydrolytic enzyme in the acrosome must break down the cervical mucosal layer to allow sperm to travel to the uterus. So here we have sperm head, and I'll just draw the flagella like that. Right here in the top part is the acrosome, and in that area, it has hyaluronic acid, an enzyme actually has an enzyme there that will break down. So here's the egg, and the egg has like this protective force field around it called the corona radiata. These enzymes in here will break down this barrier. So let's break it down. And then the sperm can then go and fertilize the egg. But in order for that to happen, the sperm must undergo capacitation while it is in the female's vagina. Sperm cells are temperature sensitive as well and do not develop normally at the usual body temperature. Therefore, the testes and the epididymis, where the sperm develop, is located outside the body cavity in the scrotum, where the temperature is lower, right? Testosterone, androgen, or masculizing hormone, is produced by the interstitial cells. Please remember that testosterone is produced by the interstitial cells, also known as the Leydig cells. Testosterone promotes maleness and secondary sex characteristics, such as hair on the face, on the chest, muscular body, deeper voice, Adam's apple, the thyroid cartilage becomes more prominent. I would even say aggression is in that category with testosterone, allegedly. It promotes maleness, secondary sex characteristics, accessory organs, and adult male sexual behavior. Testosterone promotes the epiphyseal closure, which completes growth of bone. So remember, when say this is a bone, right? So here's the epiphyseal plate, and of course this is the diaphysis. When this plate closes, or here and here, that means there's no more growth. So if you know a shorter male, he went through puberty sooner because testosterone was being produced. His epiphyseal plates closed, he couldn't grow anymore. If you know a very tall male, he went through puberty later, and testosterone came later in his life, and he was able to grow taller before his epiphyseal plates closed. So that's why he's a bit taller. The follicle stimulating hormone produces sperm. Now we're going to have a follicle stimulating hormone in the male and the female. This is called FSH. Please put that with sperm production. Sperm production. Luteinizing hormone, on the other hand, also going to be seen when we talk about females. Hormone, that's called LH. This stimulates the production of testosterone. Right? So you need testosterone to make sperm. So you need LH to kind of induce FSH. All right, so that will kind of conclude the male reproduction. Let's take a look at the female reproduction and see what we come up with here. Female reproduction. The final outcome for female reproduction is the production of offspring and the continued existence of the genetic code. The female reproductive system also provides protection and nutrition to the developing offspring. The essential organs of reproduction, of course, are the gonads. These are the paired ovaries. Ovaries are the female gonads, and they're homologous, of course, to the testes. When we say homologous, we mean the same as. So, gonads and the female are the ovaries. We know in the male, those are the testes. They resemble large almonds in size. They're located one on each side of the uterus, below and behind the uterine tubes. Uterine tubes can also be called fallopian tubes. They weigh about 3 grams and attaches to the posterior surface of the broad ligament. The function of the ovaries are considered to be the essential organs of the female reproductive system. This means that the ovaries that produce female gametes, or ova, and ova are the eggs. So gametes are the eggs. And the eggs are housed or kept in the ovaries. So if I were to draw an ovary, these little dots would be considered the eggs. So you got the gonad is the ovary, and the gametes are the eggs. Okay? So this is the ovary. And this are the eggs. Ovaries are considered to be the essential organs of the female reproductive system. This means that it is the ovaries that produce female gametes or ova. Oogenesis is egg production. Ovulation is the release of an ovum at the end of oogenesis. So once this egg are mature, one of them ends up coming to the forefront of the ovary, and it bursts out of the ovary. Like I remember learning this in 6th grade. You can go see that sex education film. I remember the announcer saying it bursts out of the ovary as though a pimple bursts on the face of the teenager. And I was like, okay, a little dramatic. But it secretes estrogen, estradiol, and estrone, and progesterone. So 2 pretty big hormones, we'll write those down, comes from these ovaries, estrogen and progesterone. Okay? Those are the hormones that are produced by the female, by the ovaries. These hormones help regulate reproductive function. And I hope to show you a little bit of how that comes. I hope to show you that. So let's talk about the uterus. Uterus is a pear-shaped organ. It's not that big. It's about 3 inches in length, 2 inches in width, and 1 inch in thickness. Now, that is amazing to think about how small a uterus is and to think that it can hold a baby. And if you're octomom, it can hold 8 babies, so 8 fetuses. So that is a pretty amazing organ that it could get that big from being about this small. The body has a wide upper portion. The cervix is a lower narrow neck. The fundus is the bulging upper component of the body. So it's composed of 3 layers. The endometrium, that's the mucus lining. The myometrium, when you're myo, you'll think of muscle. That's the thick muscular wall. And then the parietal-peritoneum, that's the external serous layer. The function of the uterus is to permit sperm from the male to ascend toward the uterine tubes or the fallopian tubes. After fertilization, the developing offspring implants in the endometrium lining of the uterus until delivery. The myometrium allows contractions. Our myometrial contractions are the labor contractions that help push the offspring out of the mother's body. No fertilization, no conception, no implantation, then the outer layers of the endometrium are shed during menstruation. So if there's no fertilization, no conception, or no implantation, just say none of that occurs, then the outer layers of the endometrium are shed, and that's called menstruation, or menses, or your period, or the curse, or whatever you guys call it. Menstruation is a cycle that depends on the hormones, estrogen and progesterone, luteinizing hormone, and follicle stimulating hormone in varying amounts. So we talked about FSH and LH with the male. So here it is here with the female. We have follicle stimulating hormone. Follicle, I gotta put an L in here. Stimulating hormone. So that's FSH. FSH has to deal with the growth of the follicles and oocyte development. So this has to do with the eggs. Egg development. Just like for the guy, it had to deal with sperm. Here for the, luteinizing hormone. or LH, right? That, of course, has to do with ovulation. And that's getting the egg to maturity to be able to come out of the egg. So menstruation has to do with these hormones: estrogen, progesterone, follicle stimulating hormone known as FSH, luteinizing hormone known as LH, and all those hormones occur in varying amounts and degrees. The menstruation cycle lasts about, and I'll say this is on average, 28 days. It's a cycle of 28 days. It doesn't last that long. It's a cycle of 28 days. And it's measured from the beginning of menstruation. I need you to understand, though, that that cycle is quite variable from woman to woman, and even in the same woman, from month to month. So really it's going to depend on what's going on in the female's life, because sometimes she may skip a month just due to stress, or it could be due to excessive exercising, and sometimes she may have this menses in the same month, two in the same month. So it's really going to depend on a lot more than just, every 28 days we're going to have. But we use that as a guide so that we could talk about when we have the LH surge, day 14, and then you have ovulation. We use that to know that now after that, progesterone will be a huge part of the graph, and estrogen comes first, and then progesterone follows. And then, of course, after ovulation, you have a huge LH surge on day 14, and then the egg comes out of the ovary, blah, blah, blah. So we use that as a guide, but it's not really exactly the cycle is 28 days. It's just a guide for us so we can explain it a little better. So with this LH and FSH, I don't know if I can really draw this, but let's just look at, this is going to be LH. I'm just going to draw it in a roundabout. And okay, so that's LH. And then FSH. And this is FSH. I need you to know that during this time, if I could just draw another thing on top of this, try to explain this. During this time, I'm going to try to superimpose a little bit of estrogen here. I don't know if this is going to work. So you can see that hormone. I'm trying to put all the hormones on here. And then progesterone. If I could just do it here. So I want to compare that to, we're going to make this day 14. So here's 0, here's 28. Let's see if we can talk this through. So with the females, let me draw this. Here is the uterus. So here's the fimbriae. Here, I'll draw the fundus, fimbriae here. All right. Really, this isn't straight. It's a muscle that's kind of like that. Okay, that's the vagina. Here is going to be the cervix here. And so you got a little hole there because the sperm have to find their way. This is the uterus, also known as the womb. These are the fallopian tubes here. And I'm going to kind of draw an ovary here, but it's kind of just in a ligament. They're not attached. I know that kind of looks weird, but just say that's a broad ligament holding the ovary in place. So this is the ovary. And so I'm going to make the walls of the uterus thick because that's the way it is when there's before the period. So kind of thick. That's day, so get day 0 here. All right, let's see if we can walk through this. So the walls of the uterus, the endometrium is pretty thick. It's getting thick at this point. And you got, let's compare these two. When I'm talking about it, we're going to compare, let me just write this so you'll know what the green line is. The LH and the FSH are to be compared, and then the progesterone and the estrogen are to be compared. Okay? And these are days. So always kind of know what you're looking at, hormones versus days. All right. So here we're gonna, let's just look at what's going on. Here the estrogen, let me just say, the progesterone level is kind of low. When we're talking about estrogen and progesterone. Progesterone is kind of low here, right? And we'll talk about the surge in a minute. But here the estrogen is low too, but not as low as the progesterone. And you can see it's increasing a tad here. And what's going on is the uterus is getting thicker and thicker. The lining of it is getting thicker and thicker. Blood cells are accumulating, tissue is accumulating, and it's getting thicker and thicker. All right. What is happening here is FSH is a little low, and we see it's going to peak here, but LH is low too, but a little higher than FSH. So we just compare these two, LH with FSH, and compare estrogen to progesterone. I just put it all on one chart. And then I want you to look at the uterus. At this point, day 14 though, so all along here, boom, 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 nothing's really going on. The uterus is building up, it's lining, and it's really hardly anything really going on. But estrogen takes a little peek. It's like, hey, get ready to start something, estrogen. And just as it takes a little jump, right after that, luteinizing hormone hits. And this is on day 14, by the way, day 14. So we look at day 14 with a surge in luteinizing hormone as the day of ovulation. The egg has left the ovary. The mature egg has left the ovary. And as it leaves the ovary, so it's left, and now the fimbriae are gently sweeping. It has a lot of cilia in it. They're not connected, by the way, but it's sweeping, has a sweeping motion. And it kind of gently calls the egg this way, and the egg starts to float down the fallopian tube. Okay? Like that. At this point, the uterus lining is getting thicker and thicker. Let's see if I can make it real thick. All right, it's very thick now. Why? Because it is in preparation of a sperm coming up through the vagina, finding this little hole and swimming. Does it know to go right? Does it know to go left? It doesn't know. The egg has come out over here and it has to know to go that way. Otherwise it won't find the egg. But most of them are getting acid balls thrown at them in the vagina. Most of them are getting bumped up against things. It's dark in here. It's hostile. They can't find a little hole, so a lot of them die. And a lot of them go the other way and go, oh my gosh, I went the wrong way. So only the lucky one reaches this egg, and we'll say that it fertilizes it. As the fertilized egg now comes on down, it will implant in this nice thick uterus wall waiting for implantation. And there are other hormones that they communicate, and placenta starts to be formed on the mother's side. Placenta starts to be formed on the little fertilized egg side, and then you start to get growth of an embryo, a fetus, then eventually a baby. Okay, so that's the way that goes. But the point is that during all that, I want you to see progesterone surges up, right? Progesterone stays up in order to maintain a pregnancy. Progesterone's up, it maintains a pregnancy. Estrogen will start to fall. Luteinizing hormone and follicle stimulating hormone will also start to fall off. But let's say there was no implantation. The egg just came on down. You're still going to have estrogen and progesterone kind of staying up, but then it will start to decrease. And you can see it decreasing here. When it starts to decrease, that means there was no fertilization. The egg just came down. It just came down, came down. And now that gives it a signal to have menses. And all of this starts to shed. And that's how you get a period. If it was implantation, the progesterone would stay maintained high. But since it wasn't implantation, progesterone started to die, nosedive. Estrogen started to fall off too. And then after you get to 28 days, it starts that cycle all over again. Boom, boom, boom. And that's that. That's about the best way I could explain that. That is the male and female reproduction in a nutshell. The next one we'll talk about, and I may just tag it onto this. If we have enough time or enough space on this, I'll put endocrine up. So now we're going to introduce endocrine so we can get a good idea of how hormones are released and secreted. So here we are with the pituitary gland. It's a little gland that sits in the base, it sits in the brain in a little place called the sella turcica. So here is, it looks like it's two glands because you have an anterior pituitary here and a posterior pituitary here, but really it's one gland that's kind of got two sections to it. So let's go on and look at the anterior pituitary gland first. The anterior pituitary gland secretes growth hormone, which regulates the growth and the length of the bone, especially along the diaphysis. And, if you got a lot of growth hormone, you could become very tall. A little growth hormone, you may be a little shorter. It has to do with other hormones as well. Here's the adrenal gland. Remember, the adrenal gland sits on top of the kidney. Little triangular shaped gland that sits on top of the kidney. It's got a lot of things going on in it. It secretes in the cortical section of it, so the outer portion of it secretes mineral corticoids like aldosterone comes from here. You remember that? Cortisol, which is a stress hormone, comes from the cortical region of the adrenal gland. And androgens can also come from the cortical region of the adrenal gland. Now, in the medulla, the middle part of it is where we get our adrenaline, hence the word adrenaline. That's epinephrine, and norepinephrine comes from right here in the middle of it. So that is secreted that comes from the anterior pituitary. Here's another hormone, the thyroid gland is stimulated by the anterior pituitary. It's a thyroid stimulating hormone, comes from the pituitary, and will stimulate the thyroid gland. The thyroid gland is there to keep our metabolism in check. So you talk about hypothyroidism. A person has a low energy, usually will be easy to gain weight, feel cold when other people in the room feel warm. If it's a female, she may have very scant menses. There'll be constipation, really hair will be dry, skin is dry. But if it's hyperthyroidism problem, then the person may feel warm when everybody else feels cool, will have unexplained weight loss, be very hyper agitated, have heart palpitations, just quite the opposite. So if it's hypothyroidism that is controlling the metabolism, everything is decreased and low. Constipation, depression, just low. If it's hyperthyroidism, everything is hyped up, activity, everything is really in a rush. Here is gonadotropin hormones. You got FSH and LH. You know they come from the ovaries, stimulating testosterone, stimulating sperm, stimulating egg production and ovulation. Here is prolactin from the mammary gland that helps with milk, making milk. And so that when the baby gets ready to suckle, there will be milk there. So that's all from the pro, meaning for lactin, for milk, for lactation. So here, that's everything from the anterior pituitary, right? Let's go over and look at the posterior pituitary. Interestingly enough, the posterior pituitary only secretes these two hormones here. I want you to know that the posterior pituitary gland is actually an extension of the hypothalamus. It's an extension. You see the nerve fibers coming from the hypothalamus in the posterior pituitary gland. It is an extension of the hypothalamus. Please note that the hypothalamus reads the blood everywhere when the blood comes through, up in the brain. The hypothalamus reads it and tells the pituitary glands what to do. And it dictates, hey, go to this tissue and tell it to slow down, tell it to speed up, give it more hormone, give it less, whatever. So the hypothalamus really, in my opinion, is the master gland because it tells the pituitary what to do. Now let's look at the posterior pituitary, which is actually an extension of the hypothalamus, secreting two hormones here. Antidiuretic hormone, ADH, you know that's a really big one coming from the collecting duct, acting on the collecting duct and the distal convoluted tubule in the kidney, and that will prevent any urine from being secreted at all. Oxytocin is a hormone. Males and females have oxytocin. I know they're just showing a uterus and a breast here, but men also have oxytocin. This helps with contraction of the uterus, and it helps with milk let down in the breast. So when the baby does begin to suckle, yes, there's milk there because of the prolactin in the anterior pituitary, but then for milk ejection, it must come from this hormone, oxytocin, so the milk will come out and be able to come out and go into the baby's mouth. So it helps with contraction to push the baby out of the uterus. And it's also a hormone that is released when we give each other hugs. It's a comforting hormone, and men do also have oxytocin. So here's anterior pituitary releasing about 6 hormones here, and here's posterior pituitary releasing 2 hormones. Let's go up here and look at these guys here. Let's show you where the pituitary gland is located in the brain. Right here, if you can see it. Did they show it over here too? Yeah, right here. And they're kind of comparing it to the pineal gland here. Where's the pineal gland? Here. Pituitary gland we just went over, but the pineal gland is an interesting gland in that here it is here. You can see it here or here. It's also in the brain. It really does regulate your sleep-wake cycle, the pineal gland. So if you're traveling overseas or you're traveling to another time zone, even you don't have to even go, this country is large enough that you can go to another time zone by going from Detroit to, say, LA, a 3-hour difference. Whenever you get to that other time, please do what the locals are doing. If you get there at 2 in the afternoon, don't go, oh, I'm so tired, I'm going to sleep. It'll mess up your whole vacation, your business trip, whatever you're there for. It's 2 in the afternoon, you stay awake with the others, eat your late lunch, and stay awake and go to bed at the time that the locals go to bed. That's with any country that you go to. Do what the locals are doing. It'll get you on a circadian rhythm a lot quicker, and that's what the pineal gland does. It gets you in rhythm with the sun, the moon, the stars, whatever. Let's go down here in the throat area, here and here. We can see that this is the thymus, and the thymus is there really for T cells to go in there and where's the thymus? Oh, whoa. Here is the thyroid. Yeah, I misspoke. That's the thyroid. That's in the neck here. That's the thyroid. The thyroid gland is there, as we spoke about, having to regulate the metabolism. Parathyroids are these four little glands around the thymus will help regulate calcium, okay? They will help regulate calcium. Now let's go on down, and just a plop of thymus that sits right in the mediastinum on the heart. Here's the thymus here, here's the thymus here. Please note the thymus is there, and that is where T cells go to mature, so that is part of our immunological system. What is this? It looks like that's the pancreas here and the pancreas over here. Of course, the pancreas is there to help regulate everything because it's involved in with enzymes, but we're talking about hormones now. So hormonally, the pancreas is involved with glucose and just metabolizing and making sure that insulin and glucagon are released. Those would be the two hormones that are released from the pancreas. We got the kidneys here, but what sits on top of the kidneys is what we're interested in, and that will be the adrenal glands. The adrenal glands, as we discussed before, on the cortical region, on the outside region of the adrenal glands, that's where we have three hormones, aldosterone, cortisol, and the androgens. And then in the middle, where the medulla is in the adrenal glands, that's where we get epinephrine, right? Okay. Let's go on down and look at these. This is the uterus here, the ovaries here. I think we got ovaries in this guy. I guess they're hermaphrodites. I don't know. They got ovaries and testicles. Okay. So here, the ovaries here. Of course, you know the ovaries are going to release LH, are going to release estrogen and progesterone. Here and here. You got the testes that are going to release testosterone, and of course both sets are going to be involved with getting stimulated from luteinizing hormone and follicle stimulating hormone. Okay, so that's estrogen and progesterone, and that's testosterone. In the ovaries, estrogen and progesterone, and in the testes, there will be testosterone. So let's go over to the other side over here and take a look at the we talked about the female, we talked about the uterus already, and I just wanted to show you what a normal uterus would look like as far as the drawing, so that you would understand that this is how the uterus looks. They cut away so that you can see the endometrium, the part that sheds during menses, and the myometrium, the muscle part that contracts when the woman is trying to give birth. We see that the ovaries are here and here. We got every little egg that's in ovaries. I need to make a point that females are born with all the eggs they're ever going to have. And I wanted to make a point that this one is, and that they alternate on what days on which months the eggs are going to mature. So January might be this ovary, this egg will come out here. Then February, this ovary will mature an egg, and that egg will come out. March, this one. April, this one. So they alternate. And if you just have one ovary, that's okay. The other remaining ovary will usually take over the job And there's no loss of fertility just because you have one ovary. You can still maintain pregnancy, get pregnant. So I just wanted to show you the names, that the name of the fallopian tube, there are names. Here are the fimbriae, those are little finger-like projections. I want you to note also that the ovaries are not connected to the fallopian tube at all. So the egg literally just floats, and the fimbriae kind of do a sweeping motion because they have cilia on it, and they will kind of sweep and get the egg up in here. I want you to note the first part of the closest to the uterus, that's called the isthmus of the uterine tube. Then we have the ampulla of the uterine tube and the infundibulum of the uterine tube. So I want you to know it's the isthmus, the ampulla, and the infundibulum, going from closest proximal to the uterus to distal, and those are the fimbriae. So that was the main thing I wanted to show. Let's look here at the male, just briefly, just so you could get a good picture of him. I wanted to show you, this is the bladder, of course. Here's the ureter coming in from the kidney, going in. But I wanted you to see the connection. I know I drew this before, but here's the seminal vesicle. And I want you to see the ejaculatory duct going into the prostate gland here. This is a sagittal view, so you can only see one side of it, but it's two of them. And here's the urethra coming on down here. So I just want you to get a picture of this. Here's the scrotum. What sits in the scrotum is the testes. Inside the testes, of course, are a lot of seminiferous tubules. So the sperm has to come all the way out through here, go around here, come through the prostate, go out through the urethra, and then go into the vagina, if that's where it's going. So I just wanted to give a general picture of that. Now the next thing is I have some, we'll start here. I want you to see that this is cancer of the testes. I think you can see here, this is the tumor here, and this is the tumor right here. Here's the tumor, and this is cancer of the testes, spermatocord, and the left testes with mixed embryonal teratoma and choriocarcinoma. So sometimes when you see a teratoma, that means it could be like other tissues in your teeth, hair, and other things. So they're just showing the spermatocord, which is the vas deferens, and then the tumor here. Let's look, I don't think I have anything else on the male, but the rest of this are female. Can we look at this one? Let's look at this. Now I want you to look at this thing here. This little wiggly white thing. This is plastic thing. This is, this person had a PID, a pelvic inflammatory disease, due to this IUD, intrauterine device, that caused a lot of inflammation and infection. So the uterus was perforated. You see that this is all into the uterus. This is uterus material. And I'm showing you this because I want you to reconsider things like this in the body. At first, we didn't even know how IUD worked, like what it did, but I'll tell you what it does. When it's inserted, it just keeps the uterus in an inflamed state, and that's not really healthy. And when the uterus is inflamed, nothing wants to implant in it. In other words, it's a hostile type of environment for a pregnancy. So that's how it really works, because this is a foreign body, but you see it perforated. I really want to caution women about their birth control and caution them to consider the male using condoms, because that will help keep you safe from STDs, and it will not mess up all your hormones if you're taking the pill, if you're getting all these shots, if you're getting foreign things stuck in your uterus. I just really want you to reconsider. And I know the gynecologists push these kind of things because it's easy for them. But as far as for you taking responsibility for your sexual and your reproduction, use condoms, and you should be the one in charge of the condom to make sure that it is a nice a nice condom and not one that's set in a glove compartment, you know what I mean, or in his wallet. So we want it structurally intact, is what I'm saying, so we won't have any oops. Anyway, let's look at this one here. This is endometriosis. This is the right ovary with endometriosis. This is the left ovary and the inner lining of a cyst here. Endometriosis is really tissue from the endometrium. If you remember, when the uterus sheds, the endometrium comes out. This is tissue that is no longer where it should be. So the endometrium has however, it has gotten into other tissues. So that can happen through surgeries. That can happen through like accidents, car accidents, where your pelvic is crushed. Some endometrium goes to other places, and for women it can be quite painful, especially during intercourse. So endometrium, we don't really know how to cure that. People want to just keep cutting it away, but I'm not so sure that's quite the answer. Not so sure if that aggravates it, makes it worse, or if it makes it better. I don't know. Let's look at this one. This is a large ovarian cyst here. I want you to see this. This is the cyst in an ovary. This is the normal ovary right here. Now, how in the heck did this woman walk around with this thing for it to get that big? And this was the normal ovary size here. And this is the cyst inside. So here's the uterus here and the fallopian tube. Of course, this woman had looks like a complete hysterectomy, where they removed the uterus, the part of the cervix, and the ovaries. Hysterectomies are one of the major causes of surgery in females, and usually it's because of this. Let me show you this. These are uterine fibroids, also known as leiomyomas. This is it. This is a number one cause of getting a hysterectomy, because just having these are just so much blood loss. You just feel so tired, and it can make your abdomen protrude, and it just can be a big hassle. So, but my point is, if you do have to get a hysterectomy, if you just have to, ask the doctor to keep your ovaries so he doesn't put you into a premature menopause. So try to keep your ovaries, and you can have the regulation of the estrogen and the progesterone and go into a regular menopause. Here, though, the leiomyoma, these are usually benign. I've never known a case where these became malignant or cancerous. There's just a lot of the muscle of the myometrium. It's just like, have you ever seen somebody make cotton candy and they just keep going around and around? It's like something did that in the uterus and took the myometrium up. I've felt these before. They're quite spongy, but that is a number one cause of hysterectomy. Let's look at this one. I think this one is just a normal anatomy of female. So it's fallopian tube here, the ovary is here, here's the uterus, kind of cut open so that you can see the cervix, and it looks like part of the labia majora, it looks like. So this is just anatomy of the female reproductive system with the ovaries, the uterus, and the fallopian tubes and the vagina. This is of a postmenopausal woman. So it looks real shrunken here, but in the actual human, if it wasn't dissected out, it would have a lot of ligaments and things holding it, stretching it, and it would look quite different. All right, Wayne County Community College students, this is going to conclude our lecture series on YouTube. Reproduction and endocrine will be the end of our lectures. I just wanted to tell you that I think you are a great group. You did a lot of hard work. You hung in there till the end, and you crossed the finish line. In the future, I wish you much success, and I want to make sure that you contact me, let me know how you're doing, And as scientists, always do your own research. Don't go by hearsay. And please eliminate the pseudoscience from your life. And you know what is big for me. All that cleansing and getting rid of toxins and drinking alkaline water and doing enemas and all this crazy stuff people are doing to themselves. Just drink your water, eat your fruits and vegetables, and hang out with well-meaning, good people. And be a good person yourself. I'll see you around.